Aortic stenosis comes in essentially three varieties. One is rheumatic heart disease, which we see in poorer countries and developing countries in the world. Occasionally you see it in the United States, especially with an immigrant population coming in from other places. But the two leading causes of aortic stenosis are either congenital conditions that you're born with, where instead of having 3 leaflets in the aortic valve, you may only have 2 leaflets. It's called the bicuspid valve. That occurs in up to 2% of the population. It's very, very common. And that tends to cause a valve which is inherently a little bit tight because those 2 leaflets don't open quite normally. And then as a function of wear and tear and lots of flow going through that valve with every heartbeat, that valve can become tighter. At the same time, even a normal aortic valve, as people get older, can also develop wear and tear. We call that degeneration of the valve. You know, these valves open and close with every heartbeat throughout the entire lifespan. And so you can start doing the mathematics of how many times that valve opens and closes with each heartbeat over the course of minutes and hours and days and many, many years. And so the wear and tear on valves sometimes also can make valves develop thickening. And with thickening, they have less ability to open. Calcium deposits can occur, which makes the valve even tighter. And so as people get older, and we see development of aortic stenosis, and since the population in the United States and the Western countries of the world is also increasing, as the population ages, we're seeing lots of patients now who have aortic stenosis coming to a doctor's attention at age 85, 90, or even older. And again, most people feel fine with these valve conditions, but some patients develop symptoms. And particularly with aortic stenosis, once symptoms develop, this is no longer a benign condition. Any person who's got symptomatic aortic stenosis really needs to be seeing a physician because not only will this condition get worse and the symptoms get worse, but it also identifies people who are at risk of dying.